The Power of the Patient project really enlightened me, I guess, to the rights of patients and kind of looking at it from that perspective. Because as a public health major, I was focused more on diseases and not about the people, but about the systems. And I think the project really brings together the patient and the provider part and really tells patients to challenge the health systems that they're in to create a better healthcare for everyone and for patients and providers. So I think it really just enhances the way health is seen by patients and how it is handled by providers.
One of my favorite parts about this project was going to the support group. I think that was really eye-opening because a lot of patients don't have someone to advocate for them, and when they're dealing with a long-term illness, sometimes it feels tasking to require so much help and to need so much. It feels like you're almost always asking for help, and I think it's important to advocate for them and help them understand that they do have certain rights, and that as well as striving to get great health care, they also should feel that they deserve the care that they're receiving and that they deserve to be treated with respect, have low wait times, and often they address this to you, that they feel that they're not getting as much time that they should with their doctors, and they don't know how to put their foot down and really ask for the help that they deserve. And I think it's important to have someone to be there for them. Often you hear them say they don't have family to go with them to appointments and that they can't really pay someone to advocate for them. So giving them the tools to advocate for themselves, I think, is really empowering and important to me. So I became a part of this project because I'm interested in becoming a doctor in the future, and I thought since I learned so much about things from the doctor's perspective in terms of providing care, I should learn about the patient's perspective as well in order to build that relationship that I desire with my future patients. I also thought it was important for people to know what rights they have when they go into the doctor's office. And through this project, I didn't realize how much of this information isn't common knowledge and how important it is to tell patients and providers what patients have a right to and what they deserve when they go into the doctor's office, because without patients, doctors wouldn't have their customers, and their patients should be able to demand the service they deserve, and in order for the healthcare system to keep going.
Being part of the Power of Passion project was an opportunity for me to interact with medical students and residents in order to educate them about patient rights and expectations, so they can provide a better healthcare service for the patient. And also advocating for patient rights is important to me because it helps to improve healthcare service for the patient and empower them to make better healthcare decisions. In this project, we can see it was based on the Patient Bill of Rights, which empower the patient to make a good healthcare decision when they need to.
I became part of this project because after my time spent as a public policy major at University of Delaware, I recognized the need for patients being able to advocate for themselves and know how to do that. And patient rights are so important to be able to improve health outcomes for oneself and just the population, which is something that I've always been very interested in throughout my time as a public policy major. And patient rights are just something that are so important and something so small that somebody could really do to help improve their outcomes throughout the healthcare system.
I think a lot of people don't realize that they have these rights. I think that personally, I didn't even know anything about patients' rights until I joined the project and figured out that these things that these doctors do aren't right. Like, I just thought going into a doctor's office would take all day. Like, I thought it was just a normal thing, or like seeing the doctor for 5 minutes is just something that happens. Like, it's normal, but then I realized that it's not. So I think that the project really opened my eyes to see what's right and what's wrong. And I think going forward, I think I'm going to tell people about that and show what's right and what's wrong, and that they have these rights no matter what.
Power of the Patient Project has been very important to me as a future healthcare administrator and practitioner. It's allowed me to connect with future doctors and with current patients in a way that empowers them with knowledge about the patient's expectations for their visits and the patient's rights when they do make a visit. Only by properly recognizing and accommodating a patient's rights and expectations can we elevate the standard of care that every customer in the healthcare system experiences.